Hi, students of Sioux North and Sioux Lookout, Ontario. I'm really happy today to connect you with Ralph Young. He is an X-ray technologist from Kingston General Hospital, and we're really glad that he's offered up some of his time during such a busy time in history when we're just so thankful for all the frontline workers who are doing such an incredible job. So to have this opportunity is pretty special. So I'm going to ask Ralph the questions on your behalf. Your teacher sent them to me. I'm going to stop sharing my video because I really want, all the focus needs to be on Ralph. So Ralph, what type of post-secondary training did you need to have in order to be an X-ray technologist?
Right. So when I trained, and I started training back in 2007, there were two different kinds of programs available. Coming out of high school, you could apply directly to a university program, which would be 4 years. And that included a bachelor's degree, oftentimes in the health sciences or the life sciences, of which you would study for 2 years, followed by 2 years of specialized training in X-ray technology. And at the end of the day, what you come out with is a bachelor degree along with your diploma for X-ray technology. And then you write your licensing exam, and assuming you pass that, now you can practice with all of the credentials of an X-ray technologist and also have your bachelor degree if you wanted to pursue other graduate studies from there. The more popular stream that we've seen become more prominent in Ontario nowadays is a 3-year program through a number of different colleges. And that is, like I said, a 3-year program wherein you come out with your diploma for X-ray technology. And again, at the end of that program, you can write your licensing exam and you could still do the same job. You can still practice. The disadvantage, so to speak, for that kind of program is that you don't have a bachelor degree coming out of it. And so if you wanted to pursue further studies from there on, for whatever reason, you may find yourself in a situation where you had to get a few additional undergraduate credits before moving on to those. So I came out of Queen's University through their Life Sciences with X-ray Technology program, which was the 4-year degree diploma kind of program.
Awesome. And how did you know that you wanted to become an X-ray technologist?
This one is a very difficult question, I think, because uh, I wouldn't be able to honestly say that when I was in high school that this was what I wanted to do. If anything, it was really when I started training in the program that I discovered that how much it really suited me. And the story that I keep telling my friends and colleagues is that when I was in high school, what I did was I had a choice between X-ray technology and life sciences and health sciences. Uh, as their own individual programs. And on the day that I was supposed to decide, I flipped a coin and then I landed on X-ray technology. And I actually spent a lot of time afterwards trying to figure out whether or not it was the right thing for me. And I think I first knew that it was the right call because I came to realize that a lot of my colleagues who also work in healthcare oftentimes find themselves committing a lot more time and their resources towards their profession. So I have a lot of friends who are medical doctors, and they find that they commit a lot more of their personal time to their jobs, and they love it, but at the same time, it takes a lot of their time and energy. Whereas at the end of the day, I get to come home and I don't have to take my work with me back home. There's no obligation or there's no pressure to really bring my work back home simply because oftentimes I can't. My job is to be there at the site and take really good x-rays or ensure that my equipment will do the same. And then when I come home, that's it. I get to put my work away for a solid 12 16 hours and then go back and do the same thing the next day. And I think that really contributes to a very good work-life balance that I very much enjoy.
That's awesome. So if the students are considering a career like that, what kind of responsibilities would they have in their job throughout the day?
Right. So, in my particular case, I'm what's known as a general X-ray technologist and also an interventional X-ray technologist. And I think the best way to kind of explain how or what it is exactly that I do is to simply show you some of the pictures, some of the X-rays that I take. So I'm going to start sharing my screen here um, in a second. There we are. This might just take a second because my computer sometimes doesn't like it when I do this. And Mally, just double checking, are you able to see the shared screen?
Absolutely, it looks great.
Excellent. Okay, so what we're looking at on the screen is a chest x-ray, one of the most common x-rays that we take in the hospital setting. And what we're looking at, or what we're looking for in a chest x-ray is uh, whether or not any of that anatomy seems out of place. So on a chest x-ray, we could see a lot of very important anatomy. So for example, right down the middle, we have the heart, and then they're surrounded by very, very black looking spaces, which are where your lungs are. And in this particular picture, they're very much filled with air, as they often should be. And depending on how that anatomy changes in appearance, that can tell us, or at least very well give us clues as to some of the things that might be happening with our patient. That big black arrow over there is actually pointing to a very, very subtle fracture in this person's ribs, which you might not be able to see on the screen very well. But I think the power in x-rays is better demonstrated by this next slide over here, where we're again looking at chest x-rays on two very, very different patients. And even compared to the x-ray we were just looking at over here, we can see that the lungs look very different on these two particular patients. So on the right-hand side patient, what we're seeing are two different lungs that look very, very different. This one on our patient's left-hand side and our right-hand side looks a lot darker than the lung on the other side. And that's because this person's lung on this side has collapsed, and all of their lung tissue is now pressed up against their heart, and within their chest, but not within their lungs, is a lot of air where it's not supposed to be. In fact, all that air is pushing all of their lungs off to the side. And if we look at the patient on our left-hand side, this person's lung on this side, where it looks completely white, is also collapsed, but we can't really see it as well because this person's chest is filled with fluids, which is collapsing that lung. And just by looking at this chest x-ray, we can't really tell what kind of fluids is actually really pushing on that person's lungs. But this is still a very powerful tool, a very powerful image that can tell us, okay, there's definitely something wrong with this person's lungs. And maybe we should try and investigate how we can fix that issue so that we can make our patients feel a lot better again. So that my job in all of this is to create those images, is to get our patient into a position and to use the equipment in a very specific way, and to use what's called ionizing radiation, or X-rays in this case, to generate this kind of image. So then other healthcare professionals, such as nurse practitioners and doctors, can then take a look and go like, yep, that seems to be our problem. That seems to correlate with what our patient is feeling. Let's figure out how we're going to solve this. So my job is to create x-rays, which can oftentimes be the way that doctors are then able to say for sure whether or not something is happening to a patient. It can confirm a lot of their guesses, if you will, about what's going on with a patient. So this kind of work is what a general X-ray technologist would do. And of course, chest X-rays are not the only thing that we do. If I scroll down a bit, we'll start seeing things like abdominal X-rays, and then we also do X-rays of people's bones. In this particular case, very sadly, this person has very, very aggressive cancer. And what we're looking at is the pelvis and the hips of this person. And we can see that the bone of the pelvis looks very different even just within the pelvis, we see these dots that look very, very different from the rest of the bone of the pelvis, which tell us that this person has very aggressive cancer. So things like that would be what a general X-ray technologist would do. Like I was mentioning before, I'm also an interventional X-ray technologist. And the big difference here for interventional versus general is that we use X-rays to create images, which we then uh, use those images to guide us on our way to fix something. So whereas with the chest X-rays we were looking at, a lot of my job is to take an X-ray and tell a story as to what's going on with that patient, and then it would be up to somebody else to figure out what else we're going to do with regards to making that patient feel better. As an interventional X-ray technologist, what I do is I help create the images which in real time allow us to then go in and fix a problem. So one of the things that we do, for example, is we do X-ray studies, X-ray video, if you will, where we can actually visualize a person's blood vessels within, in this case, we're looking at a brain, or at least half a brain in this case. And what we're looking for in this particular patient is a blood vessel that is very much not supposed to look like that, where they have a blood vessel that seems to be ballooning out. What happens if you have a ballooned blood vessel, every once in a while, the walls of that vessel get very, very thin and they can pop. As you can imagine, if a blood vessel pops, you can bleed out. And when you bleed out in the brain, that can be very, very serious. So as an interventional X-ray technologist, what we do is we create these pictures and we provide multiple angles for the interventional radiologists who are doctors who are trained to then go in and start actively fixing these problems. So one of the ways that we can fix this type of problem, where we have a blood vessel kind of getting bigger and bigger and at risk of essentially just popping, is that we can go in and start filling that big vessel with something to stop it from receiving blood. So in this case, it's a little very, very thin inert metal wire that we can fill into that space, so then blood simply bypasses it and goes to the rest of the brain. And that stops blood from pushing against that vessel and potentially causing it to burst. So in interventional X-ray technologists, we help create the images so that we can then go in real time and fix those problems. In a nutshell, that is essentially what my responsibilities as an X-ray technologist are.
Oh, that's fascinating. And thanks for sharing those videos and pictures, because it really brings your career to life. That was amazing
My
to
pleasure.
see. Yeah. So what does a typical work day or work week look like for you? Do you work 9 to 5, or do you work longer shifts? Do you work Monday to Friday? How does it work when you're working in a hospital and in the X-ray department?
Definitely. So in a hospital setting as an X-ray technologist, because hospitals tend to receive patients at any point in time, and because patients who are in a hospital can get sicker and sicker at any point in time during the day, it means that there's always an X-ray technologist at a hospital for most hospitals. Sometimes there's always an X-ray technologist who is available to come back in if they're needed. So at Kingston General, we always have a team of X-ray technologists on site. And so in my particular case, I work a lot of day shifts that start from, let's say, 8 a.m. in the morning, and then I get off of work at 4 p.m. in the afternoon. And today, for example, I got in at 8:30 and left at 4:30. But it also means that myself and my colleagues will sometimes have shifts where we work from 12 at midnight at night all the way till 8 in the morning. Or I have colleagues who are on call right now who, if there are big enough emergencies that require our services, especially in interventional X-ray, they get called back in at odd hours let's say 5 a.m. in the morning to help try and find a blood clot in someone's brain or something like that. So the hours are very, very variable. But of course, the great thing about X-ray technology is that you don't necessarily have to work in a hospital. You could also work in other settings. Um, and so a lot of X-ray technologists who don't necessarily want to work nights will often try and find a clinic that they can work at, and there are multiple different kinds of clinics which specialize in just X-rays or anything like that, or other specialized procedures. And oftentimes those clinics will often operate only during the normal work hours, and so they don't necessarily have to do nights. Um, as I'm hoping that you can appreciate, is the fact that there's the work that we do is very, very diverse in nature. And so the question being what a typical day looks like, oftentimes there's not really a typical day, in the sense that a lot of the work is very different all the time and from case to case, from patient to patient. But oftentimes for me at least, I go into the hospital and it's always busy. So our 8-hour shifts are usually go by very fast, and you're often on your feet a lot, going from place to place and seeing patient to patient. And my patient interactions can be anywhere from 5 minutes long if they're only coming in for, let's say, a chest x-ray, and they're able to move relatively well. We could get them in and out in about 5 minutes. Or sometimes they could be much longer cases. So for example, the patient we just saw, where we were trying to fix one of their blood vessels in their head, they could be with us, we could be seeing them for 2-3 hours at a time. So there are days where I see 25, 30 patients across all over the hospital. And then there are days where I only see about 5 or 6 patients because of the longer interventional cases that we do.
Wow.
Mhm.
It just sounds like, even you describing it, the days seem to go by really quickly because there's a lot of activity.
Oh
Um,
yes, absolutely.
what do you like most about your job, Ralph?
Um, I would say it is the fact that there's a lot of diversity in terms of what we do. Every once in a while, we'll have patients who, every once in a while, we'll have um, very, very interesting things come across in our patients, and there's nothing quite like seeing some of these pathologies on images and being able to see, um, being able to almost peek behind a curtain, if you will, um, and really visualize what's going on with a patient. So if you can imagine somebody, let's say, breaking their wrist from falling, and and you don't really know how that wrist is broken, and then we take an x-ray and suddenly, yep, we can tell exactly how that wrist is broken. um, and that kind of clarity, and being able to be in a position to provide other healthcare professionals with that kind of clarity is one of my favorite things, is being able to provide that clarity. So a lot of the times, let's say in an emergency department, where our role as general x-ray technologists become very important, we see patients with very nondescript pain. And let's say this 80-year-old patient was walking down the stairs and kind of missed a step a little bit and then fell. And then they're like, oh, my hip really, really hurts. And then you look at their leg and it's a little bit off, and it looks weird. But just by looking at them and just by their description of their pain, you can't really tell exactly how they're hurt or how to help them, because you don't know how badly they're hurt or exactly how they're hurt. And then they get sent to us, these patients, and we do our best to get really, really good x-rays. And then all of a sudden you have all the tools that you need, where you're like, yep, this is exactly how their hip is broken. It is in fact broken. And we can't just send this patient home right away. Let's talk to surgery. Surgery is going to ask us for more pictures so that I can get a clearer picture of how that hip is broken. And then they can take a look at those pictures and be able to plan out exactly how they want to fix that hip. Being in a role where you could provide that much clarity is to me one of my favorite things.
Awesome. And what's the biggest challenge that you have at work?
um, as a general X-ray technologist, I would say the biggest challenge is getting those really good pictures, because in order to provide the clarity that I was just talking about, you have to make sure that your pictures that you're taking are good. And that often means putting patients into very weird positions, or if they're unable to get into those very weird positions, it often means finding ways to work around the limitations of what your patient is able to do and still being able to provide really good images. And that probably is the biggest challenge that I can think of. Also, also on very busy days and on very busy times, such as what we're going through right now, being able to uh, kind of figure out where you're needed most at one point in time. So, for example, right now, as I speak at 5:30 in the evening, there are 3 X-ray technologists covering Kingston General right now, and that includes the OR, that includes the emergency room, it includes every service on every floor of the hospital, and there are 3 of us. So if everybody needs an X-ray, we are suddenly in a position where we have to try and figure out, okay, who do we do first, and how do we get them? How do we get to them, or how do we get them to us? And that logistical challenge sometimes is as big of a challenge in our profession as getting those good pictures.
Okay, and I know this isn't on the list from the teacher, but
By all
it's
means.
an important part of your work. What is the equipment and the technology? Like, how do you learn all of that, and when it changes, how do you become familiar with such important and intricate technology?
So in our training as X-ray technologists, we spend, I would say, anywhere from 50 to 60% of our time, even before we start going into the clinical practicum element of it. We spend 50 to 60% of our time just learning the technology and the different ways that you can tweak settings essentially in order to get really good X-rays. So a lot of it comes down to learning that initially, and then you spend a full year afterwards working in an X-ray technology setting, oftentimes with X-ray technologists who've been doing this for many years, and kind of learning that skill as you go. So almost like an apprenticeship in the sense that it's not always something that you can just write down on a binder and then give to a person and they can read it and they'll get it right away. A lot of it is seeing another person do it and then kind of learning from experience how that equipment works and how to tweak the settings so then you can adjust for a patient who can't always do what you want them to do or what your textbook wants them to do. So I think uh, the best short way of describing or answering that question is that a lot of it is just based off of experience. Certainly, I've worked for 6.5 years now, and um, uh, having that 6.5 years of experience now makes me a little bit more comfortable with how I can tweak my equipment to generate really high quality images. I'm a lot more confident in how well I can do that now than when I started maybe as a fresh tech with a year of experience. So a lot of it is just you keep trying until you have a system that works for you.
Awesome. And what advice would you have for someone who is starting out in the career of X-ray technologist or interested in becoming one? What kind of maybe volunteer work could they do, or what courses in school can they take in high school? What kind of advice could you give them?
Um, I would say that if you wanted to really prepare yourself for a career in X-ray technology or even just any of the medical imaging sciences, um, kind of gauge how much or kind of get yourself familiar with what the healthcare setting is like now. Because I think I was talking about the one of the biggest challenges is trying to understand uh, where your priorities are with regards to getting a patient or which patient to see first. That's not something that's really easy to learn. And the more exposure that you have to a healthcare setting, the more that you start seeing um, how different professions start working with each other and how different professions have different priorities. And that can lead to not conflict per se, but differing priorities sometimes means that you have to figure out, okay, which one should we do first? And getting yourself into that mindset that, as much as I would love to be able to do step one, followed by step two, followed by step three, somebody else also wants to do their step one, step two, step three. And how are we going to be able to work together to be able to really do best for our patient? That's not something that's really easy to learn by textbook or easy to learn even throughout x-ray school. And so if you really wanted to prepare yourself for a field like this, get some exposure as to what our healthcare setting looks like in a hospital setting. Get some exposure as to how our x-rays and our images in general are used by other healthcare professionals to do their job. I think that kind of exposure really gives you insight as to how to do your job better. That's probably the best piece of advice that I can give. Yeah.
That's awesome. So Ralph, is there anything else you'd like to show the students, or one last piece of wisdom that you can share?
Yeah, I would say today I talked a lot about X-ray technology, which falls under the umbrella term of medical radiation technology, or I think nowadays we call it medical radiation imaging technologies. And certainly X-ray technology isn't the only modality that is used in medical imaging. From X-ray technology, you could also branch out to, you may have heard of CAT scans. So they're also X-ray technologists who specialize in a very particular piece of equipment and the imagery that it creates. There is also magnetic resonance imaging, or MRI. There's also ultrasonography. There's also something called nuclear medicine, which unfortunately I don't think I have enough time to describe. So our medical radiation imaging technologies umbrella term is actually very wide. I would say that spend some time kind of researching each one, and because of how different and diverse they are, you might find that one of our related modalities besides X-ray might be a better fit for you. So don't, as much as I would love to promote X-ray technology in particular, don't forget that there are other imaging modalities that you can look into, which are similar in their advantages, but also different enough that they might fit you better in terms of what you like.
Well, that's just amazing. Thank you so much for all the information and putting so much time into this presentation. I'm sure the students will benefit a lot. And if I were a student, I would be very interested in knowing more, just seeing those images and seeing the passion that you have for it. So I'm just going to turn off the recording, but I want to thank you, Ralph, for everything that you've done for the students at Sioux North High School in Sioux Lookout.